Hello, I'm Dr. Ross Graham, Director of the Australasian Research Institute at Sydney Adventist Hospital. What causes diabetes? As we all know, in order for the sugar we eat to get into our cells to make energy, we need molecule, like insulin, to open the cell's door. If we don't have enough insulin, or the cell door is stuck, then glucose can't get in and the blood sugar goes up. This is what we call diabetes. While type 1 diabetes happens because the body's pancreas no longer produces enough insulin, type 2 diabetes starts when the cell door gets stuck. It gets stuck closed so that the blood sugar goes up because it can't get into the cell. The body's pancreas responds by producing more insulin to try and force that cell door open. Unfortunately, in doing this, it makes the little insulin factories, it's in the pancreas again, they start to work very hard. If this continues, then these little insulin factories start to malfunction because they're being forced to produce so much insulin. And eventually they'll die. So eventually, similar to type 1 diabetes, in later stage type 2, not only are the cell doors stuck, but the damaged pancreas is producing less and less insulin. So now there is even a smaller amount of insulin able to open that stuck door. Of course, this makes the blood sugar go even higher. So what makes the cell door get stuck? Well, when the cell is working and needs more fuel, it actually makes more doors in its cell wall, so that any insulin that can be floating around can quickly bind on, open that cell door, and sugar goes in. But when the cell has got enough sugar and doesn't need any more, in other words, it's got enough energy, it starts to seal up the doors so that no more sugar can get in. Even if insulin is trying to open them, it says, no, there's too much here. Because you see, too much sugar in the cell will damage it. So it tries to limit the amount of sugar that is coming in by making it harder to open the doors. But why is having a high blood sugar so bad? Well, for pretty much the same reason that spilling a sugary drink on your mobile phone will cause it to get sticky and damage possibly a lot of sensitive parts and even prevent them from working. Well, this is pretty much exactly what happens to the body when blood sugar goes high and stays high. You see, that sugar that's floating around starts to stick to sensitive parts in the blood and the cells and elsewhere and stops them from working. So you get damaged blood vessels, and that sort of leads to things like heart disease, damage in the eye, creating blindness, damage in nerves, especially around the feet, making it difficult to feel things, and therefore you get gangrene in the feet, etc. And it actually affects the brain as well. These are all diseases you don't want, and all because the body has too much sugar and isn't able to get rid of it. So how do you stop getting type 2 diabetes? The best way to stop is eating things that will cause the body to get saturated in sugar. Don't eat them, like soft drink, white rice, cakes, you know what they are. The other thing that you can do to help the body is to exercise. That helps the body use up all of that excess sugar. Remember, type 2 diabetes is a choice, and it is up to you.